can see me now. It's my pleasure to be here. I am Talibita Moses, and I'm glad that for today I am really going to talk about um, how lawyers are very relevant in the role of trying to mitigate or reduce the impact of products that are injected or flooded into the market and that are capable of causing diseases, the worst of them all being non-communicable diseases. I anchor my argument on the fact that cancer and other diseases, call them the non-communicable diseases, such as the cardiovascular disease, the chronic respiratory diseases, and diabetes, are responsible for over 70% of all deaths globally. The majority of these deaths occur in low and middle income countries, Uganda being one of them, placing a disproportionate burden on countries that are at least equipped to respond. Even in high income countries, major social inequalities exist, especially by people in the marginalized or disadvantaged communities. This burden of disease hinders poverty reduction efforts, in particular by diminishing resources within families, reducing workforce productivity, and placing tremendous demands on already strained health systems and economies. By 2010, the economic cost of cancer alone had reached 1.16 trillion dollars annually. Tackling cancer and other non-communicable diseases is therefore an urgent development priority and one that requires concerted global action. It is essential that countries implement comprehensive and cost-effective strategies to mitigate the escalating non-communicable disease burden. Law is very central to this role. Now, I want to delve into what the law is capable of doing in the event it is tapped. Health is a fundamental human right. It is no wonder that the motto for the Ministry of Health of Uganda is "Health is wealth." Yet at least half of the global population do not receive the health services they need. Law is one of the most influential enablers of health and sustainable development and one of the most cost-effective tools available to governments to protect and promote the health of their people. Law has the power to shape norms and behavior of individuals, organizations, and governments. And in so doing, it will be reducing on the surge of diseases and the cost implication and the burden on governments helping to put money in the pockets of their citizens, thereby improving household income. When it comes to health, engaging with the law is critical at all stages. The exposure of individuals and communities to risk factors such as tobacco and alcohol, equitable access to healthcare, collection and use of health information, and experiences of people affected by cancer and non-communicable diseases, of course also the infectious diseases as COVID has shown, are all powerful or rather powerfully influenced by laws and legal frameworks from the domestic regulations to the global commitments. I'll tap into the 2030 Agenda for Sustainable Development. And in the Ugandan context, we are looking at agenda, or rather, we are looking at Vision 2040. But globally, for sustainable purposes, the 2030 Agenda for Sustainable Development is one of the global frameworks that recognizes and propels the prevention of non-communicable diseases and equitable access to health care for people affected as critical health and development priorities, with inclusion of non-communicable diseases, related goals, and indicators. In 2015, the world saw the Addis Ababa Agenda for Financing for Development. Therein, it was recognized that tobacco is directly related to the growing incidences of non-communicable diseases and rather affects health systems, health patterns, and fails the objective of realizing better health outcomes because it imposes the strain on the health system. That being the case because tobacco and the diseases it causes are largely preventable diseases. It is not a basic need that one can do without. It's not been found to have any advantages that man or natural resources can attach themselves to it. All United Nations member states have agreed to the 2030 agenda and must progress the Sustainable Development Goals. 17 integrated goals with related indicators to end poverty, protect the planet, and ensure that all people enjoy peace and prosperity by 2030. There are a number of sustainable development indicators and targets that relate directly to the prevention of non-communicable diseases, like Target 3A, to strengthen implementation of the World Health Organization Framework Convention on Tobacco Control. I must appreciate Uganda's efforts in 2015 that led to the enactment, thereby domesticating the WHO Framework Convention on Tobacco Control into a Tobacco Control Act of 2015, number 22. This, of course, was followed up by the 2019 Tobacco Control Regulations and others that relate to equitable access to healthcare, such as Target 3.8, which is directed towards achieving universal coverage for all. This also takes me to appreciating government's effort in the legislative arm that led to the enactment of a financing facility through the National Health Insurance Bill. Health and development are intrinsically linked, and advancing law to prevent cancer and other NCDs, of course, including the infectious, and protect those affected is essential to achieving the fundamental right to health and ensure countries meet their global commitments so no one is left behind. Let me talk about the dietary healthy component. Unhealthy diets are responsible for about 11 million preventable deaths globally per year. And the worldwide prevalence of obesity nearly tripled between 1975 and 2016 as the study goes, but as we speak, several years have gone by and this must be beyond the statistic as it says, because for instance, the trans fat industry is aggressively introducing or proliferating products and injecting them into the market. Many countries face burdens from multiple forms of malnutrition, including overweight and obesity, undernutrition and stunting, and lack of fruit and vegetables. Therefore, a healthy diet is critical to preventing malnutrition and a range of non-communicable diseases such as diabetes, cardiovascular diseases, stroke, and cancer. However, shifting diets and the rise of processed foods are contributing to an increase in non-communicable diseases around the world. It is about time that the legal tools be adopted to curb this trend. Once considered as a problem for higher income countries, overweight and obesity are now on the rise in the low and middle income countries, because with increasing knowledge in the high income countries, the industry that proliferates these foods is descending or clamping on the low income countries. This has contributed to a dramatic surge in non-communicable disease risk factors, including overweight and obesity, and created a double burden of disease for countries that continue to deal with undernutrition. In the Pacific, for instance, where healthy traditional foods, and in the Ugandan context, we have what we call staple foods, have been replaced with imported processed foods. 3 out of 4 adults are considered obese. This has led to disastrous consequences for people and economies throughout the region, where non-communicable diseases are now responsible for about the tune of 80% of deaths. To ensure that everyone is able to maintain a healthy diet and to meet global commitments, including the UN, that is the United Nations Sustainable Development Goals, governments must use law to promote a healthy food environment and give people the information they need to make informed decisions about what they eat, because every other time, wherever they look, deceptive marketing is reaching out to them, feigning ignorance that the food it is providing them is the safest or the easiest to access than the staple foods, as I speak for the Ugandan context. So implementing evidence-based policies that make healthier diets, or rather dietary options, available, affordable, and easily accessible to all people is vital to promote health, preventing non-communicable diseases, and protecting lives. The lockdown as a response to non-communicable diseases has confirmed to Ugandans that the agricultural industry is more resilient than any other sectors, and it continues to play its role of providing food to the most needed, including those that are in the urban areas. Alcohol control is yet the other aspect that the law needs to come in and then save global citizens, or Ugandans for that matter, as I scaled up. Worldwide, 3 million deaths every year result from harmful use of alcohol. And I must also say, unfortunately, Uganda is an alcohol consuming country as opposed to being a smoking country. Wherever you look, even on traditional functions, even on faith-based functions, alcohol is one of the essential priorities, not to mention the sodas, the sugary drinks, the energy drinks. So alcohol is a group 1 carcinogen, the same as tobacco smoking, and means it is an acknowledged cause of cancer. And in 2016, harmful use of alcohol caused 1.7 million deaths from non-communicable diseases. When citizens, or rather Ugandans, are locked up and cannot access their daily routine that was keeping them a little busy, they resort to what preoccupies them, and that is alcohol. Wherever you look, and it has degenerated into a habit that young people are increasingly drowning into the alcoholic behavior, regardless of their gender and age discrimination notwithstanding. So alcohol consumption contributes to 3 million deaths each year across the globe and is a major contributor to disability prevalence and the poor health of millions of people. Overall, harmful use of alcohol is responsible for over 5% of the global disease burden. Although it is a known cause of cancer, in many societies and cultures, alcohol consumption is often a routine part of the social landscape. As I did say, on cultural functions, on faith-based functions, alcohol is one of the essential lists. I have had people joke that they are essential drinkers. Or rather, they contribute a lot to the economy because government, through the sin tax or the excise duty levies, it imposes a very small percentage, as we will appreciate in the fiscal administration, in response to curbing alcohol consumption and reducing alcoholism. This wide acceptance and integration of alcohol in society makes it easy to overlook or discount the health and social damage caused or contributed to by alcohol drinking or consumption. The United Nations Sustainable Development Goals recognize the detrimental effects of alcohol to health, development, and societies, committing all member states to strengthen the prevention and treatment of substance abuse, including the harmful use of alcohol, which is integral to achieving health for all. Now, having given this global background, what would the lawyers do? The lawyers, in their legislative role, in their legal pieces of advice that they give every other day to organizations through the strategic policy development or to societies as they consult perhaps on what crops to engage in or what commodities to engage in, or even in the industrial sector, what are the most economically viable ventures. They play a key and central role in trying to reduce harm or just let harm go on the loose on fellow citizens. Now, Article 39 of the 1995 Constitution, as amended, talks about the right to a clean and healthy environment. Of course, also Article 40 talks about the economic rights. But then also Article 38 talks about the civic role, which means citizens have a duty to participate in all processes of government, including legislation, which is the ambit of the legislative arm, but also the enforcement. When the legislature has made the law, then the executive is going to implement this law. The lawyers are very central. And also in the judiciary or the judicious arm, as the law is being interpreted, the lawyers are also there watching. So lawyers have to help government, including even the revenue generation. Lawyers have to help government come up with mechanisms of helping it play its policing role of ensuring that citizens are less harmed by products that are injected or released into the citizenry. So the lawyers, I call upon you, I enjoin you to participate in helping government realize its role, its cardinal mandate, which mandate will save all citizens, and the lawyers will definitely play that role because your clientele will increase. I say all this for God and my country. I am Talibita Moses. I, since 2013, have been working with Uganda National Health Consumers Organization. I must appreciate their efforts for having allowed me to join into the civic society, the civil society, and play a role of ensuring that citizens are safer, citizens can consume healthy foods, citizens are not exposed to harmful beverages, and that citizens enjoy the natural ambience or the clean air. I am happy also to contribute to um, facilitating in the School of Sciences at Nkumba University. And this, of course, also has exposed me to trying to use the rather the legal tool to equip persons that are going to advise government on the wise use of natural resources, especially those that deplete and those that are sustainable. I hope I can make more contribution, and I hope this can benefit all of us. I owe you.